Hi, this is Dr. Randy Grill, nursing home dentist. I'd like to talk about my nursing home patients that have dry mouths or xerostomia. If you read my records, I'll usually have xerostomia marked. And I'd like to talk about it because if your loved one wears a denture, it makes it very difficult for the upper to stay in. Dentures get suction like you put water between two pieces of glass and you can hardly get it apart. That's what saliva does for the mouth. It also lubricates the tissue like oil lubricates an engine. They get less sores, it's less painful. Saliva just makes dentures work. Without saliva, they don't work so well. We're going to talk about the results today and not the elimination of it. I've found over 10 plus years in just nursing homes that the POAs that chase eliminating a dry mouth or xerostomia sometimes eliminate their loved ones because these are life-saving meds. And so all I can do is say we live with it. When the mouth dries out, dentures don't fit well, they can't be worn. Sometimes the last resort is using a zinc-free denture adhesive, but some of our patients don't like goo in their mouth and it challenges them. It can even trigger failure to thrive, depression, different things like that. We're working with a human being. Some of the things like implants aren't possible most of the time that would just click the dentures up. In the last 10 plus years, I've only seen a handful that would be implant candidates if they could afford them. The other thing that a dry mouth does is on certain toothpaste with pyrophosphate in them, it makes the teeth hurt more because with lots of saliva, the toothpaste that uses the acid chemicals are diluted and it's not a big deal. But once the mouth starts to dry out, and there's dozens of reasons why, don't chase it too hard with a physician because you're going to unbalance your loved one's meds, and it may not even be the meds that are creating the dry mouth. So we're not sure which way to go. So it can hurt the mouth from your whitening toothpaste that they shouldn't use. That's why we recommend AIM, the regular AIM for 88 cents. It's put low in Walmart because you got to get on your knees because they don't want to sell them. They want to sell you the $3 and $4 tubes. So another thing that a dry mouth does to our patients that have teeth, if they have other challenges like GERD, which is a little regurgitation after meals, which puts acid in their mouth is dry, no saliva to dilute that acid from their burps. That's called GERD. Also, that the GERD, if they pool food, which means they've got a dry mouth, now they've got acid, now you can go from a fair mouth to almost gross caries, which means, huge cavities everywhere that are root canal and crowns are needed within 3 months. No matter how well the nursing home is caring for their mouth, a dry mouth does damage. It puts gum disease in aggressive stages that put you in need of periosurgery, periografting, different things like that. The tissues are so fragile that to recommend those treatments can actually make mom or dad worse than they are. So this is more information on what to expect. There really is no cure or change from a dry mouth. People try lots. There are dry mouth toothpaste, dry mouth denture creams by Biotene, dry mouth salivas. Most people won't even take the saliva. You spend a lot of money and it's slimy. It's hard for me to stomach. So in a nursing home, now if you're 40 years old and you have a dry mouth, you have options. But in our nursing home patient base, which you need to know about a nursing home. It's a high-tech hospital in a unsuspecting environment. 24 nursing care. Most of the meds that they're given were IV drip 30, 40 years ago. And we say often Senecott in the AM for a BM in the PM has allowed mom and dad to live years longer than what we did before some of these simple penny medications have filled nursing homes. So this is Dr. Randy Grill, nursing home dentist. See you on another video.